Tonight, there's some homegrown vaccine on the horizon for Canada, but the warnings are still there for a third wave of the COVID-19 virus.
It's a constant battle with the government and the industries that are in and around our territories.
The Tsilhqot'in First Nation opposes the dumping of more effluent into the Fraser River.
Children in care often don't have access to those venues, and so in that way it is to try to develop those kinds of programs at the community level.
And a new program in the Yukon gets ready to send its graduates into the real world of keeping families together.
Good evening and welcome to APTN National News. I'm Brittany Hobson. Quebec continues to assure the public they're dealing with racism issues within their healthcare system, but allegations of racist behavior by medical staff are still being made public. Joining us now is Quebec correspondent Lindsay Richardson with the latest on a new complaint made by an Atikumek woman over the weekend. Lindsay, thanks for joining us today. So this latest incident started with a visit to a clinic in Joliet. Can you tell us about that?
So everything we know so far about this case comes from a very short Facebook post published over the weekend by the Assembly of First Nations Quebec Labrador Regional Chief Ghislain Picard. So in that status, he mentions a case where an Atikumek woman, who we now know is named Jocelyn Ottawa, went to seek outpatient services at the CLSC in Joliet on Friday afternoon. And while there, she alleges that she overheard some racist remarks coming from nurses. And once nurses saw that she was from Manawan, the same community as Joyce Tsilhqot'in, she was allegedly told, well, we'll just call you Joyce. So that's about as much as we know at this point. There has not been a formal complaint filed yet, but the incident has caught the attention of political leaders and is obviously bringing up a lot of outrage in the moment.
And so how quickly did officials move to respond to this, or have they responded to this?
Well, almost immediately, the AFNQL labeled the incident as unacceptable, and that's about the same thing that the community of Manawan said in their press release on the subject. The CLSC also confirmed, or the Regional Health Authority overseeing the Joliet CLSC confirmed yesterday that the two nurses in question were suspended without pay. The Regional Health Authority is allegedly very disturbed by this incident, and it is being investigated. But there's no word yet on the fate of these two staffers and whether their jobs will be cut as a result of this incident.
Now, has there been any reaction from the province yet?
So Yann Lafrenière, our Minister of Indigenous Affairs, made a statement to CTV News saying that they are aware of the incident and they're working to verify the facts in the case. We ourselves have not been able to confirm this with the ministry by broadcast, but Quebec has in the last couple of weeks announced a series of measures hoping to correct these sort of health system issues in the area of Joliet, particularly how they impact the Atikumek community members. So part of those gestures were appointing an Atikumek representative to the health authorities board. They're looking to streamline the complaints process. So they do feel that these issues are being addressed slowly but surely, but no statement commenting on this case directly. Premier François Legault is expected to give a press conference this evening. This issue will surely come up then, but we have to wait and see.
These allegations come less than a week following news of another case. Some are saying eerily similar to Joyce Tsilhqot'in's. Can you give us a little information on that?
It's really quite an incredible story, and the details are still emerging, but a woman, a Cameroonian refugee living here in Montreal, also allegedly sought care at a hospital on the South Shore in Montreal and actually went to Facebook Live, much in the same way that Joyce Tsilhqot'in did, to claim that she was injected with a substance she was allergic to even after notifying healthcare practitioners on site of the allergy. So she asked in that Facebook video to be transferred to another hospital establishment, which she was, but she did pass away a couple of days later. The hospital is not currently commenting on the case. We are aware that there is an investigation underway, and we'll have more details about political reaction and community reaction to the similarities between these two awful, awful cases tomorrow.
Okay. Well, thanks again, Lindsay. We'll end it there, and looking forward to that coverage tomorrow.
Thank you.
A traditional ceremony was held in Vancouver to welcome the arrival of vaccines for elders. APTN's Tina House was there and has the story.
It's finally the day that everyone here at the Luma Medical Clinic has been waiting for, the arrival of the COVID-19 vaccines.
This is a time to celebrate and a time to feel hope, a time to feel hope that we're close to the end of this pandemic.
Elder Saislem led a traditional ceremony outside, offering a smudge and prayers for the vaccines. Marge White is the first to get vaccinated, and she was welcomed in with a traditional song.
And you're going to get the Pfizer vaccine today.
This is the arm where I got my shot. I don't feel anything right now. I don't even feel, prick or anything, and so I'm sure that I'm going to be fine and look forward to my second shot in about a month, and so yeah. So it's good. I feel great today. I'm happy that I got the shot.
Luma Native Housing operates the Luma Medical Clinic, which is hosting the elders' vaccinations. Norsa Mongrain works at the clinic, which is now in its 5th year. She says it's a special place.
We're righting the wrongs in healthcare. A lot of the patients that I see in counseling have actually been harmed by the health system in residential schools, Indian hospitals, TB Indian hospitals, and there was a lot of fear around it. And so by doing it this way, we're trying to ease some of that fear.
Reginald Percival is Nisga'a, and his traditional territory has had a COVID-19 outbreak recently. He also just lost his sister-in-law from COVID-19 2 weeks ago.
This, I think, is a positive move for us to be getting a vaccination. I want to encourage all Aboriginal people to try and get a vaccination when the opportunity is available.
And we're so happy today to be able to honor the elders who are coming forward to get vaccinated, to demonstrate to their families how important it is to protect themselves and to protect the people that they love around them.
The vaccinations are just for the elders for now, but Luma Medical Clinic hopes to roll out more vaccinations for other age groups in the next few months. Tina House, APTN National News, Vancouver.
And we want to hear what you think about the COVID-19 vaccine rollout in your territory. Here's how to continue the conversation. Send your emails to news@aptn.ca. Leave a comment on aptnnews.ca. You can also find us on Facebook, Twitter, Instagram, YouTube, and now TikTok. Follow APTN News to join the conversation and see our latest stories. The Government of Canada officials had a bit of good news today in terms of Made in Canada vaccines. But as Jamie Pashagumskan reports, they also had some concerning news for the near future, saying we could be on the cusp of a third wave of COVID-19.
Canada announced Canadian drug developer Medico has entered final stages of trials of their COVID-19 vaccine, bringing Canada one step closer to making a domestic vaccine. It's part of an overall strategy.
Aim at reversing a 40-year trend by supporting short-term strategic actions with a long-term vision. Indeed, by investing in our domestic biomanufacturing capacity, we are advancing vaccines and treatments today, while at the very same time strengthening Canada's response to any future outbreaks.
But for now, with cases on the rise again, Canada is keeping a close eye on the new COVID variants.
That speed of spread is going to be bigger than the previously existing variant or viruses.
Canada's Chief Public Health Officer announced 3,600 cases of the new variant and said the new strain will have more severe outcomes like hospitalizations and deaths.
There are many more underneath these already sequenced viruses that is, so we know it is actually occurring in Canada. So the 3,600 is kind of a tip of the iceberg, and there are many more cases with those mutations.
They say cases are particularly spiking in Ontario, where Thunder Bay is a hotspot.
maybe it's an inflection point and maybe it's a little blip that'll go down. But certainly I think the important point to emphasize is that what Ontarians do now matters, because obviously we'll see the consequences, in a couple of weeks.
Canada's top health officers warn that the new variant is in over 100 countries and accounts for 99% of cases in the UK, and will most likely be the driving force behind a possible third wave. Jamie Pashagumska, APTN National News, Ottawa.
Time now for a quick break. Coming up, First Nations in BC are concerned about a nearby copper gold mine.
It's a discharge that is coming from the Tsilhqot'in mine, and they are trying to acquire more volume to be discharged, and we are opposing that.
This week in British Columbia, the Tsilhqot'in government is challenging a permit issued by the province, which would increase the discharge from one of the biggest copper gold mines in Canada into the Fraser River. APTN's Lee Wilson has more.
The Tsilhqot'in National Government challenged a 2019 amendment for the Gibraltar mine to increase discharge into the Fraser River by 50%. Now they are presenting their arguments at a virtual Environmental Appeal Board hearing. They say the BC Ministry of Environment and Climate Change Strategy did not properly consult their nations. The Gibraltar is Canada's second largest copper and gold mine. The discharge site is near Estella First Nations, a Tsilhqot'in community. Councillor Chad Stump explains his community's stance.
It's a discharge that is coming from the Gibraltar mine, and they are trying to acquire more volume to be discharged, and we are opposing that.
The First Nations said they want the license revoked or amended to have no increase. They have concerns of untreated discharge due to the Fraser River being a sensitive area. Home to endangered white sturgeon, it is also BC's largest river with a major salmon run route.
As they're going up, they either branch off into the Tsilhqot'in, and they branch off into wherever the Thompson or wherever that is. They branch and they head all the way up to the Nechako, right? And that this is the main river that feeds, and it's really important that we're trying to protect it.
We were unable to reach Gibraltar mine operator Tsilhqot'in Mines for a comment on the story. The Ministry of Environment and Climate Change Strategy responded with an email statement saying effluent meets safe levels. The site water being discharged is primarily rain runoff, and based on ongoing testing, meets with water quality guidelines. Ministry staff continue to work with the company, First Nations, and the Tsilhqot'in National Government and other agencies to monitor the discharge and ensure water quality guidelines continue to be met. The Tsilhqot'in National Government are hoping the appeal board listens to their calls to revoke or amend the permit. They say proper consultation with Indigenous people who have laws to the territory to protect the Fraser River are needed. Councillor Stump says this has been a struggle that goes back generations.
So here in 2021, it's no different. We still have to protect, and we still have to fight for what is actually right. It's a constant battle with the government and the industries that are in and around our territories.
Lee Wilson, APTN National News, Kitimat.
U.S. Representative Deb Haaland will have a new title by the end of the week, Madam Secretary. Haaland made history on Monday, becoming the first Native American to hold a cabinet position in the U.S. federal government. Covering the confirmation hearings all along was Indian Country Today's Aaliyah Chavez. She joins us now. Hi, Aaliyah. Thank you for joining us today.
Hi, great to be here.
So we've been discussing the possibility of Deb Haaland becoming the Secretary of the Interior and how important that confirmation would be. Can you tell us what's been the reaction so far?
I have only seen very positive things on incoming Interior Secretary Deb Haaland. Yesterday, in particular, social media was just beaming with pride and nothing but good thoughts. And so it was just a very exciting day to report on what everyone had to say. There was reactions from, parents posting that their children were jumping up and down, to even elders saying what a huge, historic, monumental day. So everything in that range.
When I saw too, just some people posting, this is the first time they've seen someone that looks like them in a role like this. What will Secretary Haaland's new role entail?
Well, essentially, she will be the caretaker of the nation's public lands and waters. And this is the first time in U.S. history that an Indigenous person has held this position, but also has been on a president's cabinet. And so essentially she'll do and work on a wide range of topics, everything from conservation to natural resources, and she'll also oversee a group of key offices for Indian country, specifically including the Bureau of Indian Education and the Bureau of Indian Affairs.
Given Secretary Haaland will be overseeing the country's land and water, do you think some of her decisions are going to put her at odds with the wishes of tribes on different issues? Is this going to be a balancing act for her?
I think that's what a lot of people are sort of expecting. I know that off the top of my head, I've heard a lot of sources say that at the very least, they are very confident with having Secretary Haaland in office that tribal consultation will be respected. And so at the very minimum, that means having conversations with tribal leaders and inviting them to the table. And so I think that's a great start there.
And we'll certainly be watching as things go forward. Thank you again, Aaliyah, for joining us today.
Thanks for having me.
Coming up after this next break, a new program in the Yukon is training First Nations support workers to prevent children from going into care.
We need more resources in the communities, and who better than our own people?
Welcome back. Time now for our photo of the day. Fair weather fowl are returning, which appears to be a sign of warmer weather. This photo of some geese was sent in by Sylvia Monroe Smith. She's in the Okanagan region of British Columbia. Hope everyone is able to enjoy some warmer weather. And as you are out and about, send us your photos to share@aptn.ca for the chance to be our next photo of the day. Now let's take a look at tomorrow's weather forecast.
Here's tomorrow's weather forecast beginning on the East Coast. 6 degrees and sun in Fredericton, 7 above in Halifax, -7 in Happy Valley Goose Bay, -12 in Maine, sunny skies and 9 in St. Jovie, 6 above in Montreal, 9 degrees with a mix of sun and cloud in Toronto, 13 above in London, 6 degrees in Timmins, 7 above in Sudbury in northern Manitoba, -15 in sunny skies in Churchill, 6 above in The Paw, 5 degrees in sunny skies in Dauphin, 8 in Winnipeg, in Saskatchewan, 10 above in sunny skies in Swift Current, 7 degrees in Regina, 6 degrees in Meadow Lake, 3 above in Stony Rapids. In northern Alberta, 10 degrees and a mix of sun and cloud in Fort McMurray, 7 above in Grand Prairie, 10 degrees in Red Deer, 13 above in Calgary, over to the west coast, 11 degrees in Vancouver and Campbell River, 6 above in Smithers, Prince Rupert and Sansvit, in the Yukon 0 in Whitehorse, 5 degrees in Watson Lake, over to the NWT, -9 in Yellowknife, -12 in Watee, -20 in Colville Lake, Fort McPherson and Inuvik. In Nunavut, -25 in sun in Cambridge Bay, -20 in Chesterfield, 26 below in Pangerton, -24 in sun in Iqaluit.
A First Nation organization in the Yukon has helped develop a unique cultural program aimed at healing those affected by family divides. APTN's Sarah Connors met with some graduates of the program to see how they plan to use what they've learned to mend broken families.
These women are graduating from a program that's the first of its kind. The Yukon First Nations Family Support Worker Program is a free pilot program focused on improving outcomes for Yukon First Nations families. Students learned about their own identity, colonization, and culture as ways to address the overrepresentation of children in the welfare system. It was developed by both Camosun College in British Columbia and the Council of Yukon First Nations.
I'm a little excited, I'm a little relieved, and I'm a little nervous all at the same time.
One of those graduating is Brenda Asp. Asp is a family support worker for Champagne and Ajax First Nations. She says much of the program was centered on traditional values like consulting with elders, art, and medicines, which she plans to use in her own work.
It's a perfect time to bring some of those back and help families to become reconnected with their culture, their aspects of who they are as an Indigenous person.
I'm excited that I'm graduating.
Heather Sagers is from Nutcho-Nayakdun First Nation in Mayo. She says the community is hurting because of drugs and other issues, and she's eager to use what she's learned to help with family healing.
Some of the things I learned I can take back to my community, and we can start to strengthen some of those feelings. I think a lot of them lost that history and culture.
Dr. Norma Ann Shorty was one of the program's curriculum developers and the main instructor. Her hope is for these students to develop programs like land-based healing with their communities so families and children can be more connected to their culture.
You know, the children in care often don't have access to those venues, and so in that way it is to try to develop those kinds of programs at the community level.
The program's developers haven't decided yet if the course will be offered again in the future. Either way, graduates like Sagers are grateful for what they've learned.
We need more resources in the communities, and who better than our own people?
Sarah Connors, APTN National News, Whitehorse.
For nearly 40 years, the Mamawi Chitata Center has been acting as the grandmother for Winnipeg's urban Indigenous population. For much of that time, Diane Redsky has led the organization that tackles housing, child welfare, food insecurity, and much more. On Face to Face tonight, Redsky says, like many organizations, Mamawi is struggling to keep up during the pandemic.
COVID has only magnified the inequality around housing, inequality around food security and income security. So what the reality for many Indigenous families living in Winnipeg is that you are worse off today than you were before COVID. And so we are barely keeping up as an organization, trying to make ends meet for people and just their food security. We have now over 160,000 hampers have been delivered to families.
Stick around for that episode of Face to Face with Dennis Ward coming up in a few short seconds. That's all your APTN National News. Thanks for joining us tonight. We'll be back here tomorrow. I'm Brittany Hobson. Have a great evening.